In type 2 hypersensitivity reactions, here we are discussing dealing with cytotoxic. So here the antigen is a bound antigen. That means antigen is part of the particular cell. It is surface antigen. It can also be an exogenous antigen on the host cells. But anyway, the antigen is not free. Either it is present on the cell surface, maybe it's the R cells, or maybe it is an exogenous antigen which is present on the host cells. So what happens then to this antigen? They will react with the antibody. Mainly which type of antibody is involved in type 2 hypersensitivity reactions? IgG antibody. In type 1 mainly it is IgE, and in type 2 it is IgG antibody. So once antigen antibody has bound, now the next step is complement activation. So complement activation can take place, and then by this complement activation it can be complement mediated cytolysis, that is C5, C6, C7, C8, C9, forming membrane attack complex and killing the target cell. Or it can be complement dependent inflammation, that is the release of C3A and C5A, which are chemoattractants and cause particular inflammation. And also it can be complement dependent complement mediated phagocytosis. C3b is a best opsonin, so it can cause phagocytosis with the help of phagocytic cells. So these three can occur. In complement itself, it can be complement mediated cytolysis or opsonization, or it can be inflammation. Apart from that, it can be antigen dependent cellular cytotoxicity. And what does that mean? Here you have antigen and antibody bound together. So antibody is now bind with FAB region, and in the FC portion natural killer cells can come and attach, by which the target cells are destroyed. That can happen. That is called antibody dependent cellular cytotoxicity. Another one is antibody mediated cellular dysfunction. Antibody mediated cellular dysfunction can be two types. Either it can be stimulatory or it can be inhibitory. In some case, for example, Graves' disease, it is long-acting thyroid stimulators, that is stimulating the thyroid gland so that there will be increase in the thyroid hormone or hyperthyroidism occurs. Whereas in myasthenia gravis, autoantibodies are produced, and that antibodies are binding to acetylcholine receptors such that it will inhibit acetylcholine binding. So what happens? It will cause muscle weakness. So what are the diseases included in these type 2 hypersensitivity reaction? Two of them we have already said: Graves' disease, myasthenia gravis. Apart from that, pernicious anemia, Goodpasture syndrome, idiopathic thrombocytopenic purpura, insulin-resistant diabetic mellitus, blood transfusion reaction, hemolytic anemia, then autoimmune hemolytic anemia, erythroblastosis fetalis, drug-induced hemolytic anemia, pemphigus vulgaris. So these all are included in type 2 hypersensitivity reactions. So here the main antibody involved is IgG. These all are the examples: autoimmune hemolytic anemia, erythroblastosis fetalis. So now we will discuss about type 3 hypersensitivity reaction. It is, we have already discussed, that is immune complex mediated. Here the antigen, unlike type 2, here it is not a bind antigen, it is a free antigen. That means it can circulate through the blood. So the antigen will bind to antibody and this immune complex can circulate or it can deposit somewhere. So there will be complement activation, and since there is complement activation, complement mediated reactions can occur. Here the antigen which are involved, they can be exogenous or they can be endogenous. Just like the antigen, it can be from outside, bacteria, virus, or the antigen, it can be from our own nucleus also. And then antigen and antibody will form immune complex. So normally what happens, there will be phagocytosis and all. As we have already said, the complement activation, the C3b will cause phagocytosis, C5a will cause inflammation. But in some cases, the phagocytosis itself will not remove the entire immune complexes, such that some are remaining. So these are circulating throughout our body and they may get deposited somewhere. So they can cause two types of two effects. Either it can be a localized effect or it can be a generalized or systemic effect. One is the localized effect that can occur is called Arthas reaction. So Arthas reaction occurs, that is a localized area. The reaction that occurs, vasculitis, that means inflammation of the blood vessel, and necrosis occurs in that area. So this is mainly when the antibody is excess, this happens, Arthas reaction. Whereas there is another condition called serum sickness that occurs when the antigen is excess. Usually in case of tetanus and all, we are giving anti-tetanus serum, the host anti-tetanus serum. So mostly the patient may land up in serum sickness because the concentration, if the concentration is increased, more antigen will be there. So what happens? There is no need of a subsequent exposure. In serum sickness, just one dose is enough to land up in that. There is no need of shocking dose. So the person, generalized reaction occurs in that persons, like edema, erythema, and even it can lead up to glomerulonephritis also. So the examples of this type 3 reactions include post-streptococcal glomerulonephritis and reactive arthritis, polyarthritis nodosa, then Arthas reaction, rheumatoid arthritis, Epstein-Barr virus infection. So these all are the examples for type 3 hypersensitivity reactions. So this is what we are actually seeing, antigen antibody complex in this picture, and this is can deposit somewhere else in our body, and for example in the glomerular capillaries it can cause glomerulonephritis. If it is a small, in the capillaries of glomeruli it is causing glomerulonephritis. If it is in the arteries it can cause arthritis, that is polyarthritis nodosa. And in the joints it can cause arthritis like rheumatoid arthritis, and in the skin it can cause rash. So this is Arthas reaction. This is a localized reaction occurring, not a generalized reaction. When you are locally injected antigen and the IgG antibody is binding, now the complements are coming and there will be inflammatory C5a, C3a. So local inflammation occurs and there will be increased vascular permeability. So the fluid is released, blood vessel is occluded, so that there will be necrosis that is happening in. Initially there will be vasculitis by the inflammation, and then it leads to necrosis. Okay, so that is about type 3 hypersensitivity reaction. Now we will go to type 4 hypersensitivity reaction. that is a delayed type of hypersensitivity reaction. So usually it takes maybe 1 day or 2 day they are taking for the reaction to occur. And in the differences, usually up to this whatever we have learned, there will be antibody. In the first one we have shown IgE antibody, and the second IgG antibody. In the third also we had antigen antibody immune complexes were present, but in type 4 there is no antibody. Mainly the cells are involved. So in type 4 hypersensitivity reaction, you have the cells, or it is cell mediated. The antigen presenting cells, initially when an allergen comes, they will process and they will present it to T helper cells 1. T helper cells 1, and they are then differentiated to form delayed type of hypersensitivity cells. Now when the antigen comes again, that is in the shocking dose, what happens to this delayed type of hypersensitivity cells? They release certain cytokines. Which are the cytokines it is releasing? Interferon gamma, interleukin 2, monocyte chemoattractant factor, TNF beta, macrophage inhibition factor, interleukin 3, granulocyte monocyte colony stimulating factor. These are released. So what is the function of each? Interferon gamma will activate the resting macrophage, and what happens to them? When the macrophages are activated, they will form epithelioid cell. Later they can form giant cells. And what is the need of interleukin 2? That is autocrine fashion. It is acting, helping in the proliferation of delayed T helper cells. So we have learned something called granuloma, that in TB, leprosy. So in these conditions we can see type 4 hypersensitivity reactions. So initially there will be T helper cells, but later when they will form delayed T helper cells. And then what happens? Since they release these cytokines, maybe after taking a week, they are replaced by the next one, that is macrophage. So macrophage, they will transform into, first initially they form large flat eosinophilic cell, that is epithelioid cell. Later they will transform into giant cell, that is multinucleated giant cell. So these all with the help of interferon gamma, and that is how the granuloma formed. Now you know about tuberculin test. So this, we are injecting 0.1 ml of PPD, we are injecting. So we are asking the patient to come even 3 days after, so that if already the antibodies if present in his body, this antigen antibody will react, so that an induration will occur. So we will look for the induration. And in contact dermatitis, for example, in some people, when they come in contact with some metals like nickel or maybe some oak poisons and all, they will have this contact dermatitis. That means these substances are actually incomplete antigen, what we say haptens. So usually they can enter into our skin while we apply them to skin. For example, nickel and all can come from our jewelry, and oak poisons may be there. Also some ointments which we apply can also cause this contact dermatitis. So whenever we apply to our skin, especially when the skin is oily, these can enter through the sebaceous glands. They are actually incomplete antigen or haptens, but while they come in bind with the skin protein, they become immunogenic. So what happens the next? They are taken up by the skin antigen presenting cells, that is Langerhans cells. They are presented to T helper cells. then delayed T helper cells, then macrophage which release lytic enzymes such that the reaction occurs in the skin, and in the skin what happens? The blisters are formed in the skin. So that is in type 4 hypersensitivity reaction. You can see these antigens and what are the consequences happening here. This is the granuloma formed, the contact dermatitis, and in this way we can summarize. So in type 1 it is T helper 2 cells and interleukin 4 IgE immunoglobulin. In type 4 it is T helper 1 cells which then form delayed type hypersensitivity cells, and here you cannot find antibodies. In type 2 and type 3 you can see the complements are involved there, and also the autoimmune diseases usually comes in type 2 and type 3 hypersensitivity reactions.